this is an important topic. I think that a lot of people deal with this. I personally, when I was younger, I worked at a vet's office for some time, and I did see that they would take advantage, especially of the older, people that had pets. And like I said, those pets for them are almost like companions, because their wife passed away or whatever the case may be. They're on limited incomes, and they would come at them and give them all kinds of scenarios where their pet was going to die in order. And then you see these old people like, okay, I'll figure it out, here's a credit card. And I just thought that that was such an ugly thing to do. Like, you're taking advantage of an older person, at least do that in a really high end area. Malibu, go rip all those fuckers off, but not older elders in Hialeah, um
I can give you a comparison of a vet visit, Miami versus, let's say, North Carolina out in the country.
even Clewiston, right?
Right.
Like, even in
So,
Clewiston, there's a
but
lot
from my
more.
experience, because obviously of my two dogs, right? So if I every time I would take Luke or Leia to their vet in Miami, it would cost me between $400 and $800, depending on the situation.
Yeah.
Right? That was every time I would take them, and which was towards the end, it was kind of often. In North Carolina, and this okay, let's just do this for blood work, right? An extensive blood work in Miami will cost you about 400 and let's say $80. In North Carolina, where we have the place now, we go to the vet and the same exact blood work, because I compare them, is
That's
$175.
insane.
Yeah.
Look at the
And I
difference.
get the results right at the moment because they have their whole facility in North Carolina. And here at the vet, you're like, you'll get your results in like 2 days.
Right.
You know what I mean?
It's a
But the
ripoff.
price,
It's a ripoff. It's extortion.
and it's literally the same because I compare them. I was like, okay, let me see
Yeah.
where they're at. Like, what
They're
changed,
taking advantage of people and
in big cities.
in big cities. And we can only, testify to Miami because we've all experienced that. And like I said, I worked in one clinic for like 2 years, and I personally saw it patient after patient after patient.